You use your knowledge, experience, and medical judgment to determine the best course of treatment. But adult patients with decision-making capacity have the right to choose or refuse your treatment plan. So when a patient refuses necessary treatment, how do you protect yourself and your patient? It begins with the informed consent process. One common allegation against physicians in a malpractice lawsuit: the physician failed to fully obtain the patient's informed consent. The claim goes like this: had the patient been informed of the risks, they would not have consented, and therefore would not have been harmed. You have a duty to explain the recommended course of treatment. You must provide enough information for the patient to make an informed decision to consent or refuse. That discussion should cover the intended benefits of the treatment, the alternatives to it, and the possible risks and complications. Informed consent is not a one-time event. Treat it as an ongoing process whenever a patient's condition or treatment needs change. To better defend against allegations of failure to obtain informed consent, document the discussion thoroughly in the patient's medical record. Use an informed consent form. The flip side of that allegation is failure to inform the patient of the risks of refusing treatment. If a patient refuses your plan of treatment, obtain and document the patient's informed refusal. Patients refuse for many reasons. Some do not understand the severity of their condition or the importance of the treatment. Some are afraid. Some cannot afford the cost. Religious, language, or cultural issues may also drive the decision. Rather than writing the patient off as non-compliant or a problem, work to determine the reason behind the refusal. Identify the underlying cause, and you may be able to address it and find an effective alternative that works for both of you. Document that discussion in the medical record as well. If the patient still refuses, obtain and document the informed refusal. Cover the potential risks of declining the plan of treatment. Give the patient a chance to raise questions or concerns. Then confirm the patient understands the risks and has no further questions. Use an informed refusal form. Increased communication, better patient understanding of treatment options and refusal risks, and improved documentation all help reduce the risk of professional liability claims. Remember this: a refusal of treatment does not automatically terminate the physician-patient relationship. That relationship continues until it is definitively terminated. If continued care is not possible or mutually desirable, you may wish to end the relationship. To reduce the risk of patient abandonment allegations, follow a formal termination process. Make it respectful. Optimize continuity of care and patient safety. Follow your state laws and regulations on written notice, emergency care, and referrals. For more information about handling patient refusal of treatment, visit our website to read the full blog.